Good afternoon. My name is Anne McCusker. I'm from Belfast Healthy Cities and I'm a member of the UK Health Literacy Group. You're very welcome to this afternoon's webinar as part of Health Literacy Month, organised by the UK Health Literacy Group. We are delighted to welcome Jane Hawley as our presenter today. Jane is going to give a presentation looking at building health literacy skills with the workforce, turning training into action in Derbyshire. So the format of today's webinar is similar to the previous two. We would invite participants just to remain mute with camera off during the presentation. This just helps with the internet connection, and then you're very welcome to add comments or questions into the chat as we go along, and they will be addressed at the end of the presentation. And you can also unmute yourself and be part of the conversation and join in as well. That would be fantastic. So this is the final event for Health Literacy Month, and the recordings and the presentations from previous events will be made available on the UK Health Literacy website. We have one more event coming up in November, which I would encourage you to register for, and I'll put the link in the chat. It's a policy event on the 14th of November in Newcastle upon Tyne, and also it's a hybrid event, so you'll be able to join virtually as well. So more on that later. But now over to Jane. So Jane Hawley, you're very welcome. Jane works for Derbyshire County Council as a healthcare public health practitioner. She's supported a number of projects and areas of work in her role with public health over the last 7 years, including healthy lifestyles, NHS health checks, dementia and aging well. Prior to this, Jane worked as a primary school teacher, an adult education tutor, and a child centres worker with specialist in health improvement. Since 2019, Jane has been leading on developing and embedding a health literacy approach across the Derbyshire healthcare system so that more people can be active partners in managing their health and well-being. So we look forward to hearing more about that today. So what I'm going to do is share my screen. I know we had some technical difficulties earlier. Jane, your camera is off. So if you are able just to put it on and then just go ahead with your presentation whenever you're ready. Let's see. If all else fails, we might go to plan B. Oh, I don't want to spoil. So we seem to have lost Jane. Our connection. No. I know she said there was some difficulty earlier, just there was I think it was a power outage, so that might have affected connection. Let me see. Here we are.
And you want to stop the recording while we wait till she comes back, just so we're not recording all this bit, if that's okay.
Okay, let me just pause that. And then you might have to use your editing skills, Evelyn.
Okay. Literacy work from Derbyshire, and I've got my colleague Hayley Gleeson, who's from our Stop Smoking service, and she'll be joining me partway through for a little bit of a question and answer section. And I'm always really keen to hear what other people have been doing as well, and to make those connections, share ideas. So hopefully, yeah, either in the chat or in the discussion time afterwards, we can talk about some of the things that you've been doing as well in your areas. And also, I'm happy to get in touch for you to get in touch after the meeting. I'm just logged in on my mobile phone, so I've got very limited access to what I'm going to be able to see. So apologies. So next slide, please, Anne. So this is briefly what we're going to cover today, an overview of our journey so far in Derbyshire, and really focusing in on what we've been able to do with building the skills of the workforce around health literacy, and very much about turning that training into action. That's been really important for us here. A little bit about next steps, and obviously that discussion time at the end. Okay, next slide. So fasten your seatbelts and come with me on our Derbyshire journey. And so I've really approached this by just thinking about some top tips from our journey, but there's lots of different ways that you could approach this, and as I say, we'll be focusing in on that, building the skills of the workforce. So yeah, next slide, Anne, thank you. So my first tip is to plan your journey. This is very much your thinking time. So for us, back in 2019, we recognised that health literacy would not just support the team that I work for in public health, but it would be across our whole department within the council, and also the priorities across our healthcare system, which we call Joined Up Care Derbyshire. That's our integrated care system. And it would do this by contributing to the prevention and health inequalities agenda, because we know that most of the people at risk of low health literacy are also those who are more likely to have poorer health outcomes. So we understood that if we could train our workforce to be more health literate, they would have better conversations with patients and service users, they would produce clearer health information, and they would provide more accessible services. And so more of our residents would be supported to be more active partners in managing their health and wellbeing. Okay, next slide. So it's essential to get support from your leaders. That's what we found. So for us, our Director of Public Health and our senior management team have been very supportive, and we continue to reach out to senior leaders across our partner organisations. It's bigger than one person or bigger than one team. If we want to embed health literacy across our system, then it needs that strategic support. And our senior leaders are the ones who are going to approve any resources, so whether that's financial or human resources. So it's really important that we keep them on board. Next slide. Oops, I think we've gone on two, but yeah, no. Well, maybe there's one missing, I don't know. So this is really about encouraging you to give it a go. So just get started. And there is, as I said, there's so many ways that you could develop a health literacy approach. I don't think there's one perfect route. But we started by taking time to understand what had worked well in other areas, and particularly in Stoke-on-Trent. And Mike Oliver, I know you're on the call today, so got a lot of information and support from what they'd done already there. And then we embarked on our pilot project with our Live Life Better Derbyshire Stop Smoking service. And I'm really pleased. Hayley, I hope you've got better IT connection than myself today. So I'd like to welcome Hayley to join us, who's the service manager from the Stop Smoking service, and she's going to talk with me now about how it went for them. So are you there, Hayley?
Yes, I think so. I think I'm all connected. So if you can hear me, then that's all a good sign.
Brilliant. Welcome. I know that a lot's happened since you agreed to be our health literacy guinea pigs back in 2019. But could you tell us a little bit about your experience of being involved in the health literacy project and what the process involved for the Stop Smoking service?
Absolutely, yeah. So it was something that we're really happy to be involved with, kind of back before COVID happened, and that was a big change in public health for us. So kind of took the health literacy project on board just before COVID happened. So we kind of firstly thought, right, how can we start the project and get people talking about health literacy in Live Life Better Derbyshire, because it's quite, although we're talking to people all the time and health literacy is always kind of there for us, we didn't really know a lot about it. So it's raising awareness, I think, to start with. So providing that health literacy training for our staff group in Live Life Better Derbyshire. And then we thought, right, after we've done that, how can we keep the interest going? So we put an ask out to the team of our health improvement advisors who deliver the stop smoking support for clients in Derbyshire. And we asked whether they'd be health literacy champions so they could help us with the audit. And this included like a mix of staff, so staff that delivered the service, so managers and myself. So we created like almost like a task and finish group to start the project going.
That's great. Yeah, that was my memory of it as well, back there. So what do you think have been the biggest changes to the service as a result of being involved in the health literacy friendly audit?
I think it's making it part of your everyday work and all the projects that we do in Live Life Better, and making health literacy part of what we always do, and embedding it in a lot of our processes and project work that we do. So we're now using the new tips and techniques learned from the health literacy audit, like the teach back technique, and we've embedded them in a part of our processes for Live Life Better Derbyshire when booking clients on, right the way through to supporting them to stop smoking. And the audit helped us to increase awareness about health literacy as well to delivery staff and other managers. So now we're looking at how can we roll this out to other parts of Live Life Better Derbyshire. So we've got our weight management service and our physical activity service. So how can we adapt what we've learned in our stop smoking audit to other parts of Live Life Better Derbyshire?
Yeah, so that's great. So you're widening it out. You're not just holding on to it within your team. You're holding it. You're spreading the good work to those other services as well. And you said about embedding it. So in terms of the teach back, I think that's really interesting that it's in that sort of referral process. You know, when you first talking to people, you can use that as well as when they're further down the line and they're actually coming to your sessions. And I think you've put it in your template as well, haven't you? So that it's a prompt to some of the workers when they're going through certain aspects of the stop smoking.
Yeah, so it's part of our template. So it's part of kind of the everyday work that our advisors do, and also we do it as part of our yearly observations, both peer-to-peer observations as well as manager observations as part of the yearly kind of competency check. So we make sure it's part of that everyday delivery, and making sure that we're all used to doing those skills and kind of talking about them at team meetings and making sure that everyone is aware of it, especially new staff coming into the service as well, because that's an ongoing challenge, is kind of the changeover of staff and new people, but embedding it as part of that training as well. Yeah,
that's great. And thinking about any challenges, were there any challenges for you in being involved in this in the audit and all the work?
So I remember, Jane, back when you introduced it to us, we thought, crikey, this is a massive document. How are we going to get this all done? But kind of seeing it as it's a big project around health literacy, and it's ongoing. As I've said before, it's something that you want to embed in your service and keep kind of going back to, and things always change as well. So I think not seeing it as that big project, but also kind of splitting it down. So we kind of looked at, right, what are the easy wins and what can we do to start with, that then we can think, right, we're getting traction with this now, and kind of then leaving some of the parts of the audit for a little bit later on when we're used to that process. So we picked out two particular parts of the audit, didn't we, to then start to do some work on and actually start to see the benefits of doing the audit. So I think that was kind of a challenge, but also we kind of looked at a way around that as well. I think COVID, I suppose we can't kind of ignore that, as that was a challenge, and staff sickness throughout that, and just the changing of priorities. So although we knew this was a really big priority for us and we wanted to do it well, and we knew it was going to take time to be able to do that, but kind of our delivery staff were taking on some COVID work. So it's kind of taken us a little bit longer. We need to make sure that we've given the time that it does deserve. So I think time was a challenge for us, and just kind of always kind of giving ourselves a goal of where we're going to aim to be at the next meeting. So I know you joined us for our meeting throughout the year when we were doing the audit, didn't you, Jane? So we could kind of look where we were and right, what we're going to do next and what we're going to have done by the time that you come and visit us next time. So that was always good to have those milestones in place.
Yeah, that's great. Yeah, so yeah, we really did focus down on a couple of areas, didn't we? So the communication, so the verbal, the written, and the design aspects, and involving service users. And with COVID coming along, we just said, yeah, we're gonna take the learning from this at the moment, but very much, you know, you've gone on and you've added to that gradually over time, and that's what we want. We want people to be in it for the long haul, for, you know, commit to it long term, not just say, yeah, oh yeah, we've done that, you know, and then move on to something else. It's really about keeping it in the long term. So thanks, Hayley, that's been great. So yeah, you can, I don't know whether you're going to be around at the end for the discussion, or, you know, I don't know if you've got to go.
I don't mind staying on if I can help with any of the questions for James. So
okay.
I'll stay on, I'll go on mute.
Yeah, okay, thanks, Hayley. Okay, so next slide, Anne. Yeah, so as you have heard from Hayley, training the team was a really important part about that. It was really raising awareness. So how could they become more health literate if they didn't know what health literacy was? So that was an essential part of it. And then, you know, we don't want just people to just come on some training and then say, oh yeah, that's great training, and then not make a difference to their service and to the health of our residents of Derbyshire. So I'm just going to share with you over the next slide or two how we've gone about training and what are some of the difference that people have been on the training have said it's made to them. So far we've trained about 700 people from the wider public health force in health literacy awareness. Initially that was face-to-face sessions, so I trained to deliver the training as part of some training that was offered by Health Education England. So that was like a half-day training, focusing in on the Stop Smoking service, but then able to offer it out to sort of our public health networks. Then COVID came along, so we had to put all of those plans to one side for a bit. And it was at that time that we sort of focused on the e-learning module, which I guess quite a few of you already know about. That's the Health Education England 35-minute e-learning module that's on e-learning for healthcare website. We also approached Health Education England to see if we could upload those files onto our learning platform, because we found that would, you know, it would help our staff to access it, and it would mean that we could monitor more effectively who was completing that training. So we've got that going alongside, you know, the wider health force being able to access it on the other website. And then last summer we wanted, as we were, you know, things were getting a bit back to normal, and we were looking at how we could extend that training offer again. Public Health decided to fund some virtual sessions, and we've had 12 virtual sessions over the last year that we commissioned, and they've been really well received across the wider public health workforce. And we've just come to the end of that, so we're just capturing all the learning from those sessions. But it was really encouraging to see a wide range of roles, teams, services and departments come in to those sessions, and it was managers as well as frontline staff, which really gives you the opportunity to embed the approach through policy, through commissioning, through service development. So yeah, next slide, a little bit of stats from the training. So yeah, pre-training, 14% said they had a good or very good understanding, and that rose to a whopping nearly 97% afterwards. So we think they got it. And then yeah, there's some other stats on there. It was 86% had never been on health literacy awareness training before, so we knew that we were reaching a new audience. And as I said, a wide range of roles. So we've got people like social prescribers, care coordinators, commissioners, health improvement advisors, service development officers, community care workers, community voluntary sector workers. So yeah, a whole range of people have attended that training. Next slide, please. So here's some examples of how the training, they've said that the training's been put into practice. So we've got, you know, it's affected people's verbal communication, their written communication. It's been put into some of the commissioning specs. I like the two at the bottom because they're talking about, we often think of this in terms of how it affects service users and patients, but those two are about using health literacy techniques with the school crossing patrol. That's our staff, that, you know, that service sits within our department, so that using it to support staff with the messages, how we communicate, and also one around business services support workers. They're using that in their meetings where they often come across you know, abbreviations being used that people might not understand, or when they're writing up minutes. So, you know, it's for our staff as well as for service users. Next slide, please. Okay, so this was a really exciting project that was done with the Diabetes Education Service, which in Derbyshire sits in the Derbyshire Community Health Services NHS Foundation Trust. So yeah, there's a bit of an abbreviation there, DCHS. So there was 2 assistant psychologists who were embedded within that team, already looking at sort of like the demographic data of who was accessing the service, who was opting in to come along to those sessions. And they found that the higher the deprivation, the less likely people were to opt into that service. So they'd already sort of identified some health inequalities in who was coming along. And so I connected up with the assistant psychologists and worked with them so that they could brief the entire team on health literacy and how it could help to reduce the health inequalities. So they trained, as a result of that, they got everybody on board. They were really enthusiastic. We got them trained up, and some champions were identified from within the service, and then they began a really thorough audit of the service, looking at all the leaflets, the admin processes, the conversations that they had with people, and did a sort of pre and post audit. So a pre-audit, looked at what they could change in terms of booklets, say talking to people on the phone, their letters that they send out, and then 6 months later did a post-course, a post-audit, and they found that they'd made really big improvements to the service, and they're monitoring, they're continuing to monitor the impact of those changes. I'm not sure, I don't know if there's anybody from the Diabetes Education Service here today. I was really hoping that one of the assistant psychologists could join us, but unfortunately she wasn't available today. But I think maybe their opt-in rate has increased from 25% to 33%, but I would need to go back and check that with them. And as a result of this piece of work and them sharing that work across their organisations, sort of showcasing this best practice, really exciting development is that the service has seen how much this could help other services, this approach. And so the system has recently appointed a health literacy officer who will work across our integrated care system and support other services to become more health literate. So that's a really exciting development for us here. Okay, next slide. I'm not going to spend too much on the last two or three. I think we're nearly there now. So, but just on this one, just to highlight how important it is to make align yourself with existing approaches within your organisations, and for us a key one here is we have a programme called Quality Conversations, which supports staff, trains staff up so that they're having quality conversations with the people that they're working with, you know, working with people's strengths and finding out what matters to them, and our two approaches really complement each other so well, so we work closely with them, but this one, going on the journey together, it's really about basic partnership working, but it's so important, and just looking for, there might be lots of people who are interested in this, but they haven't got the capacity right now. We know how stretched some services are, so it's just about, you know, sometimes it's just about keeping on going back and logging that somebody's interested, and then nudging or persuading or just checking back in, you know, a few months later to see if things are any better for them, and if there's anything that you can support with. Okay, next slide. And yeah, so like any other project really, this, you know, it's about planning how you're going to evaluate it from the start, and you know, we've done quite a lot of sort of internal evaluation and reviewing, and we'd really like to find ways of externally evaluating it now, because we think there's some really really good work that's coming out of what we're doing, and we want to share, like today we want to share what we've been doing, and we want to find out from you if there's other ways that we can, you know, develop our journey as we go along. Okay, so next slide. Yeah, this is just about keep going. As I said with Hawley, we're in this for the long haul. This isn't just a, you know, let's do this for 6 months and go on to something else. I'm really passionate about it, and I'm trying not to annoy too many people by keeping on banging on about it, because I think it's really it's essential really for all the work that we're doing. And final one, I think, final slide. Yeah, so again, this is about how we can keep it going long term, and I suppose the middle bullet point there is really a key for us now. It's very much what we've been doing has been focused on the services and system side, and we're really keen to find out from patients and service users. Now that we've got you know, some of our staff trained up, it'd be really good to find out from patients and service users what might be helpful to them, you know, particularly around their conversations about health. Is there some tools and resources that we can develop that might support that, and really about strengthening our health literacy's position in our healthcare system. Okay, so I think that's it. Sorry if I've gone a little bit too fast. Very happy to take any questions. As I say, I don't know if I'm going to be able to access the chat from here. So Anne, if you could keep me in the loop as to what's going on, that would be great.
Yeah, thank you, Jane. And Hawley, you're very welcome to join the conversation now. That was a fantastic presentation. I think you addressed some really key points that you know, as we all work towards ensuring that health literacy is embedded in our policies and our processes. Some of the key points that you mentioned are certainly things that we are working on as well. I think it's really important to have the support from leaders, and at that strategic level, having an appreciation of health literacy and its benefits for all. So I think that is a really good alignment with the policy conference that's coming up in November. Certainly from our point of view, at a recent health service conference in Belfast, it was the financial director that was mentioning how important health literacy is. So I think there's value from all perspectives of the investment in it. And I thought it was really lovely to hear from Hawley as well, in terms of sometimes it can feel overwhelming when you're thinking about where do we start, or what's good enough, or how do we ensure this is embedded. So to have an audit that you can follow but also that support on an ongoing basis, because it is something that you continually have to work at. But I think it underlines all of the work that we do, health protection, health promotion, in all aspects of public health that should be there. I had one question, and then I'll go to the chat. I can see it now that I'm not sure on the screen. In terms of the e-learning for healthcare, is that available just within your area, Jean, or just England, or can anyone access that e-learning?
On the e-learning for healthcare website, anybody can access that, as far as I'm aware. Okay. You just need to register, which I think is just your email address, and yeah, it's not a complicated registration, but it can put people off, and I think that's why we wanted to actually embed it into our learning platform, so that it made it easier. But anybody can go on the e-learning for healthcare website. I mean, somebody might be on the call that can put that link in. It was developed between Health Education England and Health Education in Scotland. I think it was a joint venture.
I'm just looking for.
Yeah, Jane, basically we've had the health literacy place since our first health literacy policy, which was pretty much based on what you're talking about today, where the first policy for Scotland, making it easier, was very much focused on healthcare practitioners. And upskilling them and getting them to understand what health literacy was, where the second policy was more about making it easier, which was about more of the public health kind of approach, etc. But the module was developed and was on the health literacy place for quite a long time, and basically, just as you said earlier, the only reason that Scotland has these policies and has this health literacy place web page and all of the work that has went into that is because at policy level we had a named person in the government who took that forward, basically. And if that hadn't happened, then it's unlikely that we would be anywhere near where we are now. And then that cascaded down to a number of health literacy champions and then academic librarians who took that on. So, you know, I think that is absolutely key if you want to embed it through.
Yeah, definitely. Yeah.
Thank you, Evelyn. So let me see where the chat. So some comments there in the chat for you, Jean. Marina has said congratulations on the work that you're doing and really making health literacy realistic across public health. Sharon has asked for a link to the audit tool. Is this something that can be shared, or is it available online anywhere?
Okay, so yeah, the audit tool that we use with the Stop Smoking Service and diabetes, we're not using that one anymore because we're aligning ourselves with what Health Education in the Midlands are using. So there is, it's called a journey planner. Again, Mike, you're on the call. You've been instrumental in that, and it's on the Knowledge Hub. That's on the Knowledge Hub, isn't it? Can people access that, Mike, from there?
I'm just checking you can hear me okay.
Yep.
Yeah, hi everyone. Yeah, so that's that particular checklist. It's part of the Health Literate Organisation programme being run out of Health Education England Midlands. So I'll put the contact name in there. So if you happen to be in the Midlands in England, then that program has been set up. However, if you ask politely and sweetly, I think it might not matter where you are in the UK. So I'll put the contact name in there. Just say that you've heard about this and you'd like to find out more. And I'm sure the people at Health Education England will be very nice to you.
Great, thank you, Mike. So another question there, Jean, in reference to the smoking team, and Hawley, perhaps you can help as well. It said that they drove the changes from their audit. What was the balance of this being driven or guided by public health the health literacy team and by the smoking team? So who, was it a partnership approach? Was it support from yourself to deliver it? Or was it really something that the smoking team took on themselves and were able to drive?
Okay, so I can answer it, and Hayley, you can either agree or disagree with this. So I would say that I was providing arm's length support. So I was not, so I was very much taught the team through the tool, help them to focus, make an action plan, I suppose, as to what they were going to focus on. But the actual, the doing bit, you know, in terms of looking at the leaflet and making those physical changes, I didn't get involved at that level of detail. However, with the diabetes education service, that it was more hands-on, I would say. So I think probably from a Derbyshire perspective, we're probably going to have those two approaches going forwards. So we're not going to be able to support lots and lots of organisations with that hands-on. It's very much about upskilling people so that they've got the confidence to use, for example, the readability tool, and know that the changes that they've made are, you know, are good changes. But there might be some you know, more intensive support that we can give to some organisations through the health literacy officer. But so we're just working out how that's going to look at the moment. So Hayley, would you sort of say that, yeah, it was a bit of an arm's length support, very much sort of like encouraging you to keep going with it?
Yeah, I'd agree. I think it kept us on task, and it was really good having you, Jane, to be able to kind of ask those questions too and keep us focused on where we'll go next with the audit. I think it's important also to say that it's a high priority thing for in our public health department. So we're talking about health literacy a lot more than we previously were. So I think that really helped us then to make it priority for the Stop Smoking service, along with Jane's support. Yeah.
Great. And what was the time frame, Hayley, from you started to? Is this?
So I'd say that it's still ongoing. As well, I think I won't be afraid to kind of say that it is still ongoing. But we were hoping it would take us kind of 3 to 6 months to complete the audit, but then COVID happened and lots of different priorities took over, and some sections took longer for us to action than other sections. So I think it's ongoing, but I'd say probably a year for us to complete the bit that we want, that have completed.
And you're still committed to it. That's good.
Yeah, and with the diabetes, I would say it was more like 6 months, but with more intensive support.
Okay. Yeah. And really good to have service users involved so that information is easy to understand. That's the point of it. I liked that you pointed out, Jane, that the purpose of the training was to support the health professionals as the providers of information, which allows active engagement, because the healthcare system can be so complicated. Even if you work in it, it's very hard to engage if you're not motivated. So to have that understanding and then engage people who are receiving the information, and those are all key parts. Thank you, Linda. You've put a link in the chat to the eHealth Learning health literacy module, so thank you for that. You can access that there. It takes you through to the page. Angela has asked for the link to the event in November, so I've just put it in there, Angela. It's an Eventbrite page, but you can register there and then we'll get in touch with you and ask you if you're attending in person or online. So both options are available. So Lisa asks, hi Jane, we asked to embed the e-health learning module into our VLE, but was told it was not possible. Do you know who you asked to enable this for you?
Lisa, do you want to send me an email outside of the meeting, and then I can see if I can move that on for you.
Okay, Lisa, if you're still there, if that suits, or please unmute yourself and chat to Jane directly. So you did provide your email address, Jean. I can put it in the chat now for you.
Thank you. Thanks.
And then it'll also
Yeah.
be on the slides on the website.
Yeah, I don't do anything. I'm on my mobile. I don't.
Yeah.
Otherwise, you might lose me.
No, fantastic. Thank you for joining. I really appreciate that. Yeah, you know, it can be off-putting when things don't go smoothly.
Yeah.
So it's great that you're able to join via your phone. So Evelyn, the chair of the Health Literacy Group, was speaking earlier. She has just left, and she said that the slides and the recordings will be on the website next week. Mike has put in an email address for Sally James from Health Education England to follow up if you wanted to access the checklist, and then just thank yous. So I'll put your email address here in the chat if that's okay. Jean, if anyone else has any questions or comments, please go ahead. No. Or if there's not anything further, we can close off. So there you are. There's your email address, Jean. Well, if there's nothing further, then I would just like to thank Jean and Hawley for your presentation and your comments and insights into that practical delivery of health literacy within health service, but also getting it on the agenda in terms of a strategic priority and the drivers that help to continue. And for anyone that wants to hear more, you can contact Jean directly. And also the information will be available on the Health Literacy UK website. So many thanks for joining us today and for continuing to champion health literacy within your own settings, and good luck with that continued work. And we hope that you'll be able to join us on the 14th of November as well. Thank you.